If you're over 60, here's a question most people can't actually answer. Could you stand on one leg right now for 10 full seconds without holding on to anything? Doesn't sound like much, does it? Just one leg, 10 seconds. But here's the thing. Doctors use almost that exact test in real clinics to predict something a lot more serious than it sounds. Whether you are at high risk of a fall in the next 12 months, not someday, not eventually, the next 12 months. And in this video, I'm going to walk you through the same simple test that physical therapists and geriatric doctors actually use with their patients. It takes about 3 minutes. You can do it right now in your own living room. And by the end of this video, you'll know exactly where you stand and a full set of things you can start doing today if the result surprises you. So stick with me all the way through, because the second half of this video is where it really matters. Let me tell you something that a lot of families don't realize until it's already happened to them. Maybe it's your mother or your mother-in-law, someone who was completely fine one week, driving herself to the grocery store, making Sunday dinner. And then she slips, getting out of the shower, just like that. And here's the part that really surprises people. It's often not the fall itself that changes everything. It's what comes after. The hospital stay, the hip that never quite feels the same, the way she stops going for her morning walk just in case, the way her whole world gets a little smaller, a little more careful, a little more afraid. Or maybe it's you. Maybe you've noticed that stepping off a curb doesn't feel quite as certain as it used to, that turning around quickly in the kitchen gives you that small flicker of, whoa, that you've quietly started holding the stair railing on stairs you used to take 2 at a time without even thinking about it. Maybe it's something even smaller than that, reaching up into a high cupboard and feeling your other foot shift a little, just to steady yourself, standing up out of a low chair or a car seat, and needing a second to find your footing before you actually start walking. Walking across a parking lot at night and suddenly being a lot more aware of every crack and uneven bit of pavement than you used to be. None of these things, on their own, feel like a big deal. That's actually part of what makes balance decline so sneaky. It doesn't announce itself. It doesn't show up as one dramatic moment. It shows up as 100 tiny adjustments spread out over months and years that your brain quietly compensates for, until one day it can't compensate anymore. And that's when the fall happens. If any of that sounds familiar, you are absolutely not alone. And here's something that might surprise you. According to the CDC, falls are actually the leading cause of injury and injury-related death among adults over 65 in the United States. 1 in 4 Americans over 65 falls every single year. 1 in 4. But here's the part that gives me hope, and I think it should give you hope too. Most of those falls don't happen out of nowhere. They don't happen because of some random, unlucky accident. They happen because of a slow, gradual, and this is the key word, measurable decline in balance. A decline that in most cases nobody ever actually checked for, until it was too late. The good news, the really good news, is this. Balance can be measured, and even better, balance can be trained, rebuilt, and improved at any age, 60, 70, even 90, which is exactly why the test I'm about to show you matters so much. So let's talk about where this test actually comes from and why it works the way it does. The CDC runs a fall prevention initiative specifically for older adults. It's called STEADI. That stands for Stopping Elderly Accidents, Deaths, and Injuries. It's the exact framework that doctors and physical therapists across the country use to screen patients over 60 during regular checkups. And one of the core pieces of that screening is a simple balance test. Now, to understand why this test is so revealing, you need to understand something about how balance actually works in the human body. It's not one single thing. It's really 3 systems working together, constantly, every second you're on your feet. The first is your vision. Your eyes are constantly feeding your brain information about where the floor is, where obstacles are, where the horizon sits. The second is your inner ear. Deep inside your ear, there's a whole system dedicated to balance. It senses motion, rotation, and which way is up. And the third is something most people have never even heard of. It's called proprioception. Basically, it's your body's built-in sense of where it is in space, without even looking. And most of that sense comes from tiny sensors in your feet, your ankles, and your legs. Now here's what physical therapists will tell you, again and again. Of those three systems, proprioception is usually the first one to quietly start declining as we age. And because it declines so gradually, most people never notice it in everyday life. Why? Because in daily life, you've got 100 little safety nets around you. Furniture to grab, walls to lean against, good lighting, familiar, flat ground you've walked on 1,000 times. It's only when one of those safety nets gets taken away, like standing on one leg with nothing to hold, that the decline actually shows itself. And that is exactly why the single leg stance test is used in clinical screening. It strips away the safety net on purpose, in a controlled and safe way, and reveals what's really going on with your balance system in under a minute. So here's the test, the actual test, the way it's used in real clinical screening. First, find a wall or a sturdy countertop nearby. Not to lean on, just in case you need it for safety. Stand tall, cross your arms over your chest, or just let them hang naturally at your sides, whichever feels more comfortable. Now lift one foot a few inches off the ground and start a timer, or just count in your head. Try to hold that position, standing on just one leg, for as long as you comfortably can, up to 30 seconds. Then switch and do the same thing on the other leg. Now, what do the numbers actually mean? Based on the balance screening ranges used in geriatric care, here's roughly how it breaks down. If you can comfortably hold the position for 20 to 30 seconds on each leg, that generally falls into a healthy range for your age group. Good news. If you're somewhere in the 10 to 19 second range, that's considered a moderate marker. Not a reason to panic, but absolutely a reason to pay attention, and something worth mentioning at your next checkup. And if you're under 10 seconds, especially if it's under 5, that's a number physical therapists take seriously. In the research, that range correlates with a meaningfully higher risk of falling. Now, before you go try this, an important safety note, and please don't skip this part. If you already have any condition that affects your balance, a recent injury, dizziness, or you generally feel unsteady on your feet already, please do this test standing right next to something sturdy you can grab onto immediately. Or better yet, have a family member with you the first time you try it. Or simply ask your doctor to walk you through it at your next visit instead. Safety, always, comes first. There's actually a second version of this test that reveals even more. It's the same stance, but with your eyes closed. Now, this removes your vision from the equation entirely and isolates how much you're really relying on your inner ear and your proprioception alone. Most people's times drop noticeably with their eyes closed, and that part is completely normal. But if your time drops dramatically, that's another data point that's genuinely worth mentioning to your doctor. Now, something else worth knowing. This test isn't just a pass or fail. It's also a way to track direction over time. A lot of people assume that once you get a number, that number is just fixed, like a grade you're stuck with. But that's not how balance actually works. Balance is far more like strength or flexibility than it is like, say, your height. It responds to use. It responds to practice. Which means the number you get today is really just a snapshot, not a life sentence. There's also a reason doctors like this particular test so much, beyond how simple it is. It doesn't require any equipment, no machines, no wires, no appointment needed just to measure it. Which means, unlike a lot of health metrics that require a lab visit or a specialist, this is one you can genuinely track yourself, at home, for free, for the rest of your life. That's actually fairly rare in medicine. A real, clinically meaningful measurement that costs nothing and takes 3 minutes. So why does a simple 3-minute test like this matter so much more than people realize? Because here's the thing. Balance decline is one of the very few major fall risk factors that is actually reversible with the right kind of training. Compare that to something like bone density, which changes much, much more slowly, even with the best interventions. Balance responds, balance improves. And that brings us to the part of this video that matters most, what you can actually do about your result, starting today. Okay, so you've done the test, you've got your number, now what? Step 1. Know your number and recheck it monthly. Write it down, both legs, eyes open, and if you tried it, eyes closed too. This isn't about judging yourself, and it's absolutely not about comparing yourself to anyone else. It's simply a baseline, your own personal starting point. Then, once a month, do the test again. Here's something encouraging. Published research on balance training shows measurable improvement in as little as 4 to 6 weeks. That means this is genuinely trackable, real progress. Not a guessing game, not vague hope. Actual numbers, moving in the right direction. Step 2. If your number was already in the healthy range, maintain it. Don't assume it's permanent, because balance really is a use-it-or-lose-it system in the body. The maintenance here is refreshingly simple. Practice standing on one leg for 10 to 15 seconds while you're doing something you already do every single day. Brushing your teeth, waiting for the kettle to boil, doing the dishes. It costs you nothing. No equipment, no gym, no extra time carved out of your day. Just a small habit layered onto habits you already have. Step 3. If your number came back under 10 seconds, here's exactly where to start, and it's not where most people assume. Start with supported balance work, not unsupported. Stand facing a countertop or a sturdy chair, with your hands resting lightly on it. Resting, not gripping tightly. From there, practice shifting your weight slowly from one foot to the other. Once that feels easy and stable, progress to brief single-leg lifts, still with that support right there if you need it. Over several weeks, the goal is to gradually need that support less and less, not to force the unsupported version before your body is actually ready for it. Progress here should feel boring and gradual. That's exactly what it's supposed to feel like. Step 4, and this is one that almost nobody thinks about, footwear. Physical therapists commonly point out that worn-out shoe soles, or shoes with no real back support, think old slippers or flip-flops, meaningfully reduce the proprioceptive feedback your feet are sending up to your brain. In other words, your shoes are quietly part of your balance system, whether you've ever thought about it that way or not. A supportive, well-fitted shoe with decent tread on the bottom isn't just about comfort around the house. It's actually a functional piece of your fall prevention plan. And this applies indoors too, by the way, not just outside. A lot of people wear thin, worn-out house slippers around the home for years without a second thought, precisely because home feels safe. But remember, a huge number of falls actually happen inside the home, not outside it. So it's worth asking yourself honestly, when's the last time you actually replaced the shoes or slippers you wear most around the house? Step 5. Let's talk about lighting, because this one's easy to overlook, and it ties directly back into that vision system we talked about earlier. Since your eyes are 1/3 of your balance system, poor lighting is essentially asking your balance system to work with 2/3 of its normal information. A simple, practical fix. Night lights along the path from your bedroom to the bathroom and making sure stairwells are well lit, not dim. It sounds almost too simple to matter, but physical therapists will tell you, small environmental changes like this genuinely reduce fall risk, especially for nighttime bathroom trips, which are one of the more common times falls actually happen. Step 6. And honestly, this is the step most people skip. Bring your number to your doctor. I want to really emphasize this one, because out of everything in this video, it's the step that gets skipped the most. and it's arguably the most important one. If your result landed in that moderate or higher risk range, this is exactly the kind of specific, concrete information that makes a checkup dramatically more useful. Instead of walking in and vaguely saying, "I've felt a little unsteady lately," you can say something much more precise. "I held a single leg stance for 6 seconds on my right side and 11 on my left." That gives your doctor something real and specific to actually work with, including whether a referral to physical therapy for a full, hands-on balance assessment makes sense for you. And I want to pause here, because this matters more in this topic than almost anywhere else in senior health. This video is for general education. It is not a diagnosis, and it's not a replacement for a real medical evaluation. Balance issues can come from many different causes: medication side effects, inner ear conditions, blood pressure changes, vision changes, and more. So if your result concerned you today, or if you've had a fall, or even a near fall recently, please talk to your own doctor before starting any new exercise routine on your own, especially if you already have an existing health condition. That single conversation could genuinely change what happens to you a year from now. One more thing before we wrap up, because I think it's worth saying clearly. None of this is about fear. I know a video with the word fall risk in the title can feel a little heavy, especially if you've already had a scare, or you're watching this because you're worried about someone you love. But the reason I wanted to make this video the way I did, with an actual test, actual numbers, and actual steps, is because vague worry doesn't help anybody. A number helps, a plan helps, and balance, more than almost anything else in this whole conversation about aging well, is something you genuinely have influence over, starting today, with almost no cost and no special equipment. So if you take away just one thing from these last 25 minutes, let it be this. Don't let this be a video you watch and then forget by tomorrow. Take the 3 minutes right after this ends. Do the test. Write the number down. That's it. That's the whole first step. So let's bring it all together. The single leg stance test takes about 3 minutes. It's the exact same basic screening that physical therapists and geriatric doctors actually use in clinics across the country. And it gives you something real, a specific, trackable number, for something that genuinely predicts fall risk. Not a vague feeling, not a guess, an actual number you can act on. Test both legs, write your number down, and if that number surprised you today, that's not something to be alarmed by, that's something to act on, starting right now, today. If this video was useful to you, the next one I'm putting together walks through the exact home hazards that most families walk past every single day without ever noticing them. Small things hiding in plain sight. So go ahead and subscribe so you don't miss it. Take care of yourself, and I'll see you in the next one.